sure, like after going through this, one question that always comes up during discussions with the patient is, would I get addicted to pain medications? And that's one of the most common questions I get, regardless of the demographic. So can you just tell me a little bit, or can you just talk a little bit more about this?
Yeah, definitely. It's a really common question that comes up in clinic, especially around opioid medications that do have a lot of publicity around addiction. So the first thing is that, based on all of the evidence that we have, the chances of getting addicted to a pain medication in the population of patients with cancer is quite low. It's about less than 10% of patients that will experience any form of addiction. And pain providers are often very well trained to monitor for these risks and identify early signs of what could be addiction. I want to talk a little bit about some of the concepts around taking opioid medications that I think can sometimes get confusing for us providers, let alone for patients. And that is the concept of tolerance and dependence. And these are different than addiction. So tolerance is when the same dose of a medication stops having the desired effect. So, if you're taking oxycodone at 5 milligrams and that's doing great for your pain, and then suddenly you notice it's not doing as well anymore in managing your pain, your body may be developing tolerance to it. With tolerance, an increase in the dose or change to an alternative drug can sometimes help better manage pain. It doesn't mean that you're addicted to the medication. It just means your body has adjusted to having seen the medication, and has adjusted, and now a slightly higher dose is needed in order to effectively manage your pain. So that's the concept of tolerance. Higher doses, again, do not mean addiction if the dose is going up. However, higher doses can lead to increased side effects. And so that's the sort of balance with increasing doses of opiate medications. And we'll talk more about what those side effects look like. The other concept to talk about is dependence. Dependence can be an early sign of addiction, and that's where patients will keep taking medications regardless of the symptoms they're having. So that's where, even if your pain is well controlled, you're feeling like you want to take that extra dose of oxycodone for perhaps the other effects that it's having. And that is an important to bring up with your provider if you're starting to experience that, because sometimes, not all the time, but sometimes that can be an early sign of addiction. For patients who have a history of addiction or a history of addiction in their family, that is important information to share with your provider before starting opiate medications. It doesn't mean that you shouldn't take them, but it's important knowledge for you and for your provider to know, so that you could be monitored very closely for developing those signs. Again, most patients do not form an addiction to opiate medications. I want to reassure around that. The more common side effects and symptoms that we talk about in clinic are the other side effects of opiate medications. And the most common ones are nausea, constipation, and sedation, so feeling sleepy on the medication. So we often caution patients not to drive while they're taking these medications. Constipation can be managed if it happens, but it's good to have those medications on hand if you need them. And similarly, nausea can usually be well managed, but definitely something to watch for. The last thing I'll say is that managing medications can be really challenging. Most patients with cancer are prescribed a lot of medications. It is no easy feat to manage all those medications. So talking to your provider about strategies to help manage and to keep track of what doses you're taking. And again, letting your provider know if you're realizing that you're starting to take increased doses of medications, just so they can make sure to adjust the plan as needed. So that's a little bit around addiction when it comes to opiate medication.